So you have no impact on washing, cleaning clothing, whereas you have an impact on child rearing.
Yeah.
But that's probably because the social norm is much more gender biased for cleaning, washing clothing. I mean, yeah.
It's a good question. I'm not sure, and I'm also not sure what they trained, right, on that, because I think some of the norm movement is really coming out of the potentially out of the training. So, I think it's better to collapse them, but I do think those individual ones are interesting for this reason. So yeah, no, it's something we should figure out somehow.
Okay, and sorry, and then I leave the mic. And so just on this cost effectiveness, then if the marginal cost of adding the vocational training is very low, then it should be presented as such in the paper, maybe, because that's the kind of weak part of the paper, the value added of the vocational training. And so knowing that it's low marginal cost helps, yeah, definitely.
Okay. So we can try that. One thing we do have is fairly good cost data, so we can try and put some numbers out there.
I'm going to take the prerogative of sitting next to Clara to ask the next question, Markus. So we talked a little bit beforehand about the TOT results and how you're not presenting them, but all of us can divide in the room,
right,
and we can take your very big
multiply by 5.
We can take your impact results and then divide by basically 0.2. So or multiply by 5. You're right. I'm
sorry.
Sorry.
Yeah. It's easier for I can't divide, so I multiply.
Yeah.
Yes.
Fair enough. And that we are. What I'm saying is we're all aware of the big TOT results, and I can think of a couple of ways you could be getting that. It could be coming straight. It could be a treatment on the treated, but it could also be from these girls who are aware or through social networks. And I'm wondering if you have any thoughts about that, or if you could, speak to whether you have anything in the survey that could help with that, or, thinking through why the ATE results would be so big.
Yeah, I don't know. I don't. I don't. This is why I don't present them. I think my co-authors might present them, but I'm not quite sure why they're so big, right? And I mean, maybe this is a bit going to understanding the first stage better, but yeah.
So this is sort of in the same vein. I was interested in the size of the effect on pregnancy.
Yeah.
So that's a difference result, the 2.5
exactly.
or whatever, right?
Right.
What was the difference just for the control group? It went from 10 to 15, or it went from 10 to 50?
It was. Oh, you mean what was the secular trend?
Yes.
I'm trying to remember. It's in there. It's not huge. I don't think it's 50.
So the effect size is the 2.5 divided by that trend, right? Not just divided by where it was at baseline. So if the
when I do the percentage, the percentage is off the baseline.
No, I'm saying I don't think that's right.
Yeah, it should be off of the trend.
Yeah. So in which case it could be much, much higher, which becomes really hard to explain for a 20% participation, right?
Yeah. Yeah. Okay. Let me. I haven't done that math, but you're right. So I'll check that. Great. More unexplainable.
At least I presume that the fertility issue is fairly objective to measure. Many of the other points are, as you know, your reference point changes once you're in a life skills group or anything. Your reference point changes, and therefore your responses to interview would change. And one thing that I'm a little surprised at, the number of the change in unwanted sex, forced sex. I don't remember how you phrased it. Right. Because after all, by definition, that's not a decision of the woman.
Right.
But, it's an indirect decision if it's based on not hanging out at the bars. Otherwise, not putting yourself in a situation where you can have this imposed on you. Otherwise, how would it change by any life skill? Because after all, there's not there are not men who are getting life skill training to discourage them from this type of activity.
That wasn't balanced at this.
Right. Yeah, but I mean,
Unwilling sex.
unwilling sex is not balanced in baseline. That's right. But Howard, Harold, I think how I think about it is there's a whole bunch of moving pieces, right? So there's a whole bunch of moving pieces that I mean I think part of it is the safe space, right, where they're hanging out after school. But I also think there's that change in consumption. I'm not going to say change in income, but there's a change in consumption that suggests that they're potentially buying more things for themselves. So they're sort of disengaging from. They're potentially disengaging from a number of situations in which this could happen.
Well, then,
So
the definition of the transactional sex is unwanted sex or merely just induced by different incentives.
yeah, but I don't.
Forced.
Right, and the question is what I don't think the direction of the fact. I don't think the girls are changing their definition that much. I mean, clearly, I can't rule that out because they are being. That's part of the education. So this is an issue that they're thinking about. So to argue no change in their definition, I think, would be foolish. But I don't think it's all being driven by definitional things. I think there's some behavioral things. No, we had it was very interesting working with BRAC because there's a set of questions they don't want to. Their sense of, and I don't know what the answer is, but there were certain questions that we couldn't ask in the survey that we would have. I'm not sure that was on our list, but it should have been. So, but there are other questions where that's an issue.
Hey, Markus, it is a nice paper. Thanks. My questions sort of follow well on Harold's, I think, because I'm also very interested in the outcomes on changes in fertility and unwilling sex, and I sort of sympathize with your plight of this sort of very multi-pronged intervention, which is the kind of thing that we're involved in evaluating all the time, and trying to pull things apart and make some sense out of it. And so Clara was focusing on the sort of two prongs of sort of life skills and vocational training, but I think this safe space component of the intervention is also a really big one, and particularly for those other outcomes. And so as I think about sort of what might be driving some of the effects on changes in sexual behavior and fertility, that seems to me to be potentially really important. And it led me to start to think about how this type of an intervention might compare to single-sex education, for example. Because you're changing both you're changing girls' time allocation, who they're hanging out with, kind of their social networks, and sort of their investment in those social networks. So that's all pretty complex. And it's going to be hard for you to disentangle, but I think that's pretty interesting. I think the comparison to single-sex education on the cost-effectiveness comparison starts to also get interesting because single-sex education is not more expensive than co-ed education, as far as I know. And so, that might be another thing that would sort of induce similar behavior at sort of very low cost. So one question is just whether you have time allocation data that might kind of corroborate or sort of lend some plausibility to both sort of whether girls are spending much more time. Well, you have, I don't know what you have on sort of time working, but also time sort of spent in the clubs, time spent doing other things. You could also, I have learned a bit more about the role of information, because it does appear that that sort of some of the learning that's going on is affecting both aspirations and the vocational training results. If you varied within the treatment group randomized kind of what type of information is provided and its relevance to ultimately sort of their time allocation in work seeking and things like that, without having to change the overall design, you could just change the content, randomized content of information. You might learn then how important the information component is. The consumption gains that you find are pretty small. I think they're under $2 per month on average, converting Uganda shillings. I mean, they're significant, and that's good. because you don't find income gains as well, it could just be expenditures related to actually spending time in these clubs. I don't know whether they're sort of bringing food or or that induces some of the girls that are attending there to go do other things together later or that type of thing. But you're right. I mean, they've got to pull that expenditure from somewhere. So, thanks.
Oh, okay, I'm just going to stand up so I can see you. My name is Stephanie Saki. I'm from the Gender Department at FHI 360. Thank you very much. This is interesting. I'm sorry I haven't read the paper, so if my questions are answered, then thank you in advance. The first point I wanted to make is just a comment about measuring empowerment. And actually, the World Bank has done a lot of really interesting work on this, and there's a lot of thought about this. But I think that it's helpful to pick the kind of indicators of empowerment relative to an outcome of interest. So in this case, you could be looking at fertility reduction or unwanted sex or what have you. But then when you look at the differences in, sharing, responsibilities to wash clothing in the household might not be as important as some of the other ones where there's a significant effect. And you start to be thinking about social norms here rather than, social norms are things that are really linked to outcomes that are important to us. So that was just one point. And then my question is whether there's before the program started, whether there was a log frame or conceptual framework or something driving the interventions, because I'm having a hard time with some of the mechanisms, especially the unwanted sex one. And you're just measuring a bunch of things, but why exactly would that have happened from this intervention?
Okay, let me tackle those before we move on. So, Dan, thanks for your comments. I think there's ideas there to follow up on the information side. So the single-sex education as a comparison is an interesting idea because I was actually thinking about that this morning when I was looking over the paper and my daughter and her education. But actually it would be much more expensive because you'd have to construct, because at least the evidence I've seen is distance is a big issue, particularly for girls in a lot of cases. So you would actually have to, you'd at least need to, the question is how far apart the schools have to be, right? Whether you need to construct a whole new building at the other side of town or what. But I think it's an interesting direction to take this. I mean, that's where the safe space thing comes in. And the time allocation, we don't have a complete time allocation. So I'm trying to remember exactly what we have. We focused a lot on household chores because as well as labor stuff. I think we thought we were going to get a lot more from the club data than we did. So on that side, we're weaker. Coming to this question about measuring empowerment, I mean, and the log frame, I mean, they sort of both go together. I mean, Brack's vision, they obviously can speak better to this than I can, but is that it is about multidimensional empowerment, and it is about their assertiveness in the community and in their future relationships and current relationships. So I think their log frame, and this goes back to the multi-pronged approach, is that this is a combined intervention to improve their health, but also their voice and their control over decisions, which includes the economic realm. So, it's that's why they think it should be multi-pronged. So, that's the way. That's where we pulled those measures. There's somebody from BRAC who's part of this research, and so is very much informed by the program and their goals. Other questions? Yeah.
This on? Yeah. I'm a program person, not a researcher, and I just want to say on the point of what girls control have over whether or not they have unwanted sex. I mean, you'd have to look at the life skills training. Good life skills training would include what does a girl know to do when to get out of a sticky situation. Use humor, when to exit and how. I mean, I think there are things that you can do from a program aspect, and I think you look at what BRAC training was doing there. I also think that anecdotally, what we always use for qualitative, I mean, if girls have a stronger sense of self, they're more likely to, and that comes from girls being together in places and talking. We see that from HIV/AIDS. We see that from conflict sort of studies. Girls are more likely to say no or have the guts to say no. And that's hard stuff to measure. But that doesn't mean just because we can't measure it that it's not happening.
Yeah, no, so I agree entirely. There was and I don't know exactly what was covered, but there was a rape, avoiding rape segment to the life skills training. And so I mean, I don't know the details of each individual component, but it was definitely covered. I mean, but they also touched on related skills. So there was leadership things as well and so on. So, yeah.
How worried are you about the respondents' bias in terms of in the treatment group? They're telling you what they want to hear, but what they think you want to hear because they've been through a whole training that says you should believe X, Y, Z. So, I mean, this relates to Harold's point before, but in terms of across the board, all these aspirational questions, are these actual changes in aspirations, or are these telling you what they think their aspirations should be, but maybe haven't changed at all?
I'm not terribly worried, and here's why. So the aspirations don't move as much as I'd expect if they were just parroting stuff, right? It's sort of the age of marriage, it moves, but it's not massive, right? And number of children, it moves, but it's not massive, right? So I think those are a lot small. If there was universal sort of feedback from what they had learned in the program, I'd expect those things to be I'd expect the aspirations to be much larger. As somebody who does work on HIV, I was particularly worried about the condom use indicator now. I mean, in different contexts, these are self-reported behaviors. There are differing degrees of unreliability in it. It's always unreliable. The question is how much. And here you'd expect it to be high because of the parroting thing. The fact that fertility moves somewhat suggests that's perhaps not total parroting back to you. The STI thing, I think this is where it gets a little more complicated, particularly with the education component, because they did learn a lot about STIs. So the girls who were in the program know more about STIs than girls who aren't, and we're still trying to unpack the directions of it, that everything's moving there. So that, because there's the whole, it's self-reported symptoms, and so it gets a bit tricky. But the fact that doesn't move makes me wonder a little bit about the condom thing. So, but I don't, and then, so if you take the satisfaction stuff, it's moving where it should be moving if the program was working, right? But if they were parroting, I would expect it to blow out in every dimension, and it doesn't. Like, these girls aren't incredibly psyched, right? The ladder of life, we have the ladder of life stuff too, and that's not moving much. So I think I just don't, the results taken together don't speak to me of sort of just the feedback of what they were taught in the program. I definitely think it's a possibility, and it's something I'd be worried about, but given these bits and pieces, of course I can't rule it out, which is why we want to use some less likely to be parroted answers, but.
Markus, just to clarify the point I'm not talking about parity, because maybe it's just a subtle difference. I'm talking about, like Dana really talks about, the reference points. Once you state a norm, people think in terms of those norms. Not that they're trying to please you, but they start thinking it's slightly different.
No, and I agree. And I think the sex against the will is particularly, that's particularly prone to that, because they're learning the definition. That's what I meant when I was talking about the definition. No, I think the other stuff, there's more of a parroting problem. This is not, that's not. It's much, it's a little more complex with this, the shift in what the reference is and, you know, the definition. But my gut feeling is that I expect it to go up. But that's a very naive prior, that I'd expected the incidence to go up.
Do we have any more questions? Okay, great. Well, thank you, Markus and Clara and everyone for a lively discussion. And on May 9th, Justin Sandifor from the CGD is going to give our next talk. So we'll look forward to seeing you there.